So then anytime if somebody has a rib injury and they're having difficulty breathing and you start seeing cyanosis or bluing in the lips, that's 911. So clinically, again, it's the same type of things. They're going to have pain when they're, so fracture of the ribs, there's the complications. And then clinically, symptoms are going to be aggravated by respiration, coughing, sneezing. Pain with a stress fracture is not going to be as acute, obviously. Again, there's going to be localized tenderness, bony deformity, crepitus. And then functionally, you're going to do compression tests where you're compressing like this, front to back, side to side like that, and then you can do kind of at different oblique angles. And then as far as ligaments and cartilage, then we're talking about the chondrosternal separation, which is similar to when we talked about chondrosternal fractures. So basically it's along this line here where it junctures between bone and cartilage. Has anybody ever had that? Anybody ever had any kind of rib injuries? Sure. What happened?
Actually, I had somebody probably approaching pneumonia, and I coughed so much that I cracked it. Okay,
so she's saying that this happens too. Somebody had pneumonia and they're coughing and sneezing a lot. Sometimes they cough so hard that she cracked a rib. Okay. Other times I've had a few situations where I've had these chondrocostal separations where you get hit in a certain area and it just hurts like a okay? Pardon my French, but it's really sharp, acute pain. There's not a whole lot you can do about it until it heals. Sometimes if you have to cough or sneeze a lot, you talk about like holding the pillow, okay? Or there'll be like a rib belt that you can wear. Basically, you're trying to hold it in while you're breathing, or it hurts when you breathe or move. You're moving the thoracic cage. So it's basically, it separates here because you tear some of those ligaments that hold that together. Again, pain and forced respiration, all those same types of things. Palpation is going to be tenderness, you may feel some crepitus. And then anytime that you have these complications, pneumothorax, hemothorax, all those are, these are medical emergencies, you're not going to deal with those. You may have a patient that said they had one, prior history of one, and then anything inside of here can start bleeding when you poke it with a sharp piece of a rib. And then now if we're talking about the joints and cartilage and discs, because the rib cage kind of stabilizes everything, there's not a lot of, like you don't have really facet problems or disc herniations. Disc herniations are pretty rare in the thoracic spine. Okay? Doesn't mean it can't happen, but I've never heard of any. But then as far as the joints, like I mentioned, there are problems with this costotransverse joint here, where people can have sharp pain in this specific spot, just to the side of the center of the spine, and then a lot of times it radiates around the side, and then they have pain when they're deep breathing. Okay? A lot of times people will, if it's coming around on the left side like this, they got chest pain. A lot of times they've gone to the emergency room, they get the EKGs and echocardiographs and all that stuff, and then their heart's okay, and then they've got a problem with their thoracic spine, and that's radiating pain into this area.
You said that's the head of the rib?
Yeah. I think actually the head of the rib is the part that goes right into the vertebra, and then this called the neck. I can check on that to be sure I got it in my anatomy notes. But basically it's this right here, costotransverse joint. And then now if we're talking about repetitive injuries, You're not going to have too much in the way of compression, repetitive injury fractures in the spine, but you do have issues if there's osteoporosis. You can have compression fractures where basically that's like when you have the compression fractures, the vertebra narrows in the front, and then you tend to get an increase in the kyphosis. And then again, we mentioned that you can have a stress fracture to the rib if there's an issue where they're having some type of, let's say they have emphysema or something, they're really struggling to breathe, they're pulling on the muscles are pulling on the ribs, and you end up with a compression fracture, a stress fracture. And then the other thing as far as the skin manifestation, you have herpes. What it does is it kind of sets up housekeeping in the nerves here, and then you'll have different flare-ups where it'll break out into the skin lesion, and then it'll tend to follow these different pathways here. So you'll have pain, you'll have vesicles and things that follow the pathway of a nerve. And in the same way it gets to the trigeminal nerve in the face, you can have different outbreaks, but it hides into the nerve and then it manifests itself as an outbreak. So those are pretty much the main conditions that we'll talk about in the thoracic spine. We'll talk about the history, observation part, and then we'll take a break, and then we'll do the special tests. And then I think somebody has to take the quiz at the break. So after the break, we can go over the quiz. And then we can also review any of the special tests and range of motion and things from last week. As far as range of motion for the thoracic spine, we're just going to defer that to talk about it when we do the lumbar. We'll do thoracolumbar together. So again, when you're doing a history, the similar types of things are the same questions, right? Like I mentioned before, you want to have a reproducible way that you're always going to ask the same questions, that you're not going to miss anything. Use the old cards and all that type of thing. But just remember, like I mentioned, if you go through the old card sequence, there's a couple questions that get missed a lot of times with that is, has the injury ever happened before? Have you had any prior treatment for it? Now, in the thoracic spine, again, we're dealing with internal organs, so there may be questions as far as pain related to internal organs, or you can do like a review of symptoms, whether they have had a history of kidney problems, digestive problems. You start getting into other internal organ issues. And then as far as posture or observation, you're going to look at the standing posture from the front, from the back, and from at least one side. And a lot of times, again, with these rib head problems, the typical type of posture that you're going to see, and I don't think you ever find this with students, but people tend to be slumped over like this from reading and such. So if you're spending all your time bent forward like this, you need to, like to do, you stretch back like that. And then also people have a tendency to, if matter of weightlifting or something, they want, oh, I've got to, do bench presses and stuff like that. You focus on all these muscles, and then your rhomboids and your scapular retractors are weak. So that just adds to this type of posture. And then it's like what we had mentioned in cervical, you get this cross-postural syndrome where, these muscles get tight up here, these get weak, head comes forward like that, these muscles get tight, these muscles get weak, and you're in this type of posture. And then next thing you know, you go to turn your head and then you're stuck like this, right? So you want to look at the posture, looking from the side, just like the plumb line things that we talked about in the cervical. The plumb line, the head should be centered up over the shoulders like that. And so you want to look at the shoulders are back like this. Look for we'll talk a lot about different deformities in the thoracic spine in just a minute. So again, you're going to have your normal, you have lordosis in the cervical spine, you have kyphosis here, and then lordosis there again. So that's pretty much what we consider, quote, normal spine. But what's normal for one person might be not so normal for the other.